Hi, my name is Adewumi Babatunde. I'm here to share a story with you, a very personal story. This is not just the perspective of a healthcare professional, but the voice of someone whose life has been shaped by personal loss, pain, and an urgent need for action. This story is the cost of what it is to bring life into the world in my country, Nigeria. While I was young, my mom lost two of her sisters, Auntie Tokbe and Auntie Dele, to postpartum hemorrhage. These were people who were vibrant, industrious, full of life. Their days of joy was turned into sorrow because of lack of access to healthcare. My mom herself had to give birth to three of us, myself and my two siblings, via cesarean section. And instead of her to get support from friends and family members, she was seen as someone who was weak and unable to birth children by herself. I grew up terrified of pregnancy, and every time that I heard of pregnancy and childbirth, fear gripped me. But this is not just my story, this is Nigeria's story. Nigeria accounts for 20% of world's maternal mortality, meaning 1 in 5 women who die from pregnancy-related causes in the world are Nigerians. A girl born in Nigeria has a 1 in 22 lifetime risk of dying from maternal causes, compared to 1 in 4,900 in developed countries. The contrast is staggering. Imagine knowing that carrying your child can end your life. This does not just end with the mothers. Our infant mortality in Nigeria is 69 per 1,000 live births, and under 5 mortality is 102 per 1,000 live births. These are not just numbers. These are lives lost too soon. The Nigerian government has made some important strides. The Basic Healthcare Provision Fund is strengthening primary healthcare centers across the country. The RMNCAE plus N is improving services, while the Midwife Service Scheme is helping to train a lot of midwives to be able to take delivery and to ensure that women are safe while at it. The maternal and perinatal death surveillance is also helping to save lives. These policies show promise, but policies, while vital, are not enough. They require action, they require commitment, and people's willingness to stand in the gap. This is why I chose to act through my organization, Quinta Health. In partnership with U12 and Vitamin Angels, we have distributed free perinatal vitamins to more than 7 million women across 5 states in Nigeria, especially in Kwara and Enugu states. In 7 years, we have given these women free multivitamins that will serve them through the duration of their pregnancy. These have improved nutrition during pregnancy and increased their attendance to antenatal clinics. For the past 7 years, I have volunteered for the World Health Organization to monitor immunization to ensure that children in underserved communities get their vaccines. In Ogun State, I led the Papa LQAS, which is a survey to collect data on reproductive, maternal, newborn, and child health. This data is not just sitting down, it is the foundation for real change, including the launch of Ibidero, a free delivery service for mothers in Ogun State. I have also been involved in antenatal clinics using local languages to pass health education to mothers, in addition to ensuring that these women get all the help that they need to raise their children. In addition to all these that I've mentioned, our mobile clinic at Quinta Health goes from community to community, educating women and giving them the medical help that they need. I also create medical content on social media and talk about burning issues to ensure that everybody gets the information wherever they are. In the One Young World Global Health Academy, I learned from innovators, change makers, and youth leaders across the world. From them, I learned that the power of storytelling, data-driven advocacy, and youth leadership is not only inspiring, but it is effective. I saw how committed voices, grounded in truth and driven by purpose, can influence communities and institutions. In fact, it can influence an entire nation. More than anything, I learned this: there are no impossibilities, only actions yet to be taken. In Nigeria, the stakes are high. They are too high for silence. Every woman should have the right to give life without risking her own. Every child deserves the right not just to survive, but to thrive. We must build a health system that honors motherhood, that strengthens our healthcare infrastructure, supports and invest in our frontline health workers and treat maternal health not just as a privilege, but as a fundamental human right. Because bringing life into the world should never cost a woman hers. Thank you.